Hello everyone, myself Dr. Yogesh Arora. I am consultant physician at Sanjeevani Multi-Speciality Hospital, Rajpura, district Patiala. Today we would be discussing and understanding the heart disease in women. There could be different presentation of cardiovascular disease in women. The most common disease which we encounter is the coronary artery disease. The presentation of coronary artery disease in women is similar to men, but there could be variant type of coronary artery disease which is more common seen in women. The two common type of disease which are more often seen in women are coronary microvascular disease, in which the smaller or tiny vessels, tiny arteries of the heart are affected, and the other is broken heart syndrome, which is often seen with extreme emotional stress leading to severe but often short-term heart failure, short-term muscle failure. Symptoms in women are usually similar to that of male. This could be chest pain, tightness of chest, neck, jaw or shoulder pain, often radiating to both arms, abdominal discomfort, shortness of breath, unusual fatigue, sweating, nausea and vomiting, lightheadedness and dizziness. Often the patient may present with indigestion. But chest pain is usually the noticeable symptom. Others are not uncommon but frequently encountered symptoms which women often tend to ignore. Cardiovascular disease in women can be seen in women in different ways also. One is gestational hypertension. It is the hypertension which is seen in women in pregnancy. This could further lead to cardiovascular disease and may lead to number of complications associated with that. Preeclampsia, it occurs during pregnancy or even after childbirth. There could be swelling of body, there could be swelling of feet, there could be even seizures or chronic headache. These have serious consequences. Even a fetal death may occur because of preeclampsia. Women with preeclampsia have greater risk of developing CVD later in their age. Other is gestational diabetes. Ladies in pregnancy may develop diabetes due to persistent hyperglycemia, which can further lead to cardiovascular disease in pregnancy and later on. So it is advised that the patient should get its sugar tested at 6 to 12 weeks of pregnancy and should be repeated every 3 months till the childbirth. Other common disease which is seen which may lead to CVD is polycystic ovarian disease or polycystic ovarian syndrome, which is usually seen in young ladies which have common symptom of infertility, obesity, hirsutism and often hyperglycemia. These patients again are at higher risk of developing diabetes and cardiovascular disease. Certain autoimmune disorders are also common, which are common in female or women, which are associated with cardiovascular disease are seen, such as lupus erythematosus, rheumatoid arthritis, which are more common in women. Women often use hormonal contraceptives for childbirth control. These women, if higher than 35 years of age, often tend to develop hypertension and cardiovascular disease. Such patients may experience high blood pressure, migraine and obesity. Other common cardiovascular disease is which is in menopausal age, that is the age of 45 to 55 years of age, when there is cessation of normal cycles in a normal female. Such patients may develop hot flashes, night sweats, emotional changes, which may be associated with high BP and cardiovascular diseases. Coming to the treatment of heart disease in women, these are usually on the same line as in case of males or men. The patient should be investigated thoroughly. There should be ECG, there should be few biochemical tests which may confirm or rule out diabetes, deranged lipid profile, and accordingly the patient should be managed. If the patient is of minor symptoms, patient can be treated medically or conservatively. If the patient is having severe symptoms, even such patients may require angiography, angioplasty, or maybe bypass surgery. Few preventive measures which could be advised to women are: they should exercise regularly, maintain healthy weight with a BMI of 25 or less, should, if they have diabetes, they should control their sugar, and if they are also having deranged lipid profile, they should check their cholesterol and should take low lipid diet. They should also manage their stress, means they should improve their lifestyle, which helps in reducing their stress level, and stress related hormones will be less released, which will have less effect on their heart. Patients should follow the treatment plan which is advised to them by their doctor regularly. They should visit their doctor regularly and take the medicine as advised. It has been seen often the patient tries to titrate the medicine on his or her own, which is not the right way. Patient should, if consumes alcohol, should discontinue alcohol, and if she smokes, then she should also quit smoking. These are the few measures which would help her to maintain a good health and a healthy lifestyle, which will delay or avoid the progression of cardiovascular disease and its complication, so that she can live a healthy life. Thank you. Thank you everyone.